The Bone and Joint Surgery Clinic is one of Wake County's oldest and most well-known orthopedic practices. For almost 50 years, the Raleigh practice has been dedicated to providing patients with the best and most personalized care available. Here with us today is Dr. Johnny T. Nelson, a board-certified, fellowship-trained hand and shoulder specialist with the clinic. Welcome to the show. Thank you for being here, Doc.
Thanks for having me, Carly. It's great to be here.
Well, we are so excited that you are here. I know a lot of people are apprehensive about any kind of surgery or any kind of doctor visit, no offense, but sometimes we need a little encouragement, a little motivation to sort of take that next step with our health journeys. So tell us a little bit more about some of the conditions and syndromes that you specialize in treating.
Absolutely. So I'm an orthopedic surgeon, meaning I treat things dealing with muscles, tendons, bones, and joints, nerves, and injuries like that. So I specialize in shoulder and hands, so I did two fellowships, special treatment and training for both of those conditions.
Well, tell us a little bit more about carpal tunnel. We hear that term, but don't really know what it means and how we even get it. So tell us a little bit more about that.
Sure, Carly. So carpal tunnel is one of the most common problems. It's a nerve problem, right? It's a nerve problem that happens in the hand and wrist.
Right.
It's one of the most common conditions in this country. So about 18 million people at any given time have carpal tunnel syndrome, right? So it's very, very common. It's a very good chance that listeners, viewers out there have carpal tunnel syndrome, or somebody in their family has it. Basically what carpal tunnel is pressure on a nerve, a very important nerve that gives us feeling to these three fingers. And at the level of our wrist, that nerve there's a little pressure point here. And if that nerve is pressed on too hard, then it doesn't work properly. And that can lead to a certain set of symptoms. These symptoms mainly are numbness, tingling, especially in those three fingers, shaking your hands out a lot, driving the car holding the steering wheel, shaking your hands out when you're driving, waking up at night, hanging your hand off the edge of the bed, shaking your hand out. Some patients, if you let this go on really long, things get really bad and they start to lose feeling in their fingertips. So they drop things, they have a hard time with buttons and things like that.
Yeah. How are people getting carpal tunnel? Is it something that we can prevent?
That's a great question. There are certain populations and certain patients that I see that are kind of at risk for it, and especially those who do a lot of gripping and repetitive activity, so hairdressers and upholstery workers and things like that. Sometimes, and honestly, most of the time, though, it's kind of bad luck. It's kind of like male pattern baldness. Some things like diabetes and thyroid problems and rheumatoid arthritis can lead to carpal tunnel or contribute to that, but really it's multiple factors that cause it.
Okay, all right. Well, that's what you are here for, so you can help diagnose us and help steer us in the proper treatment for that. And speaking of, you guys offer a treatment option at your practice.
That's right, Carly. So the Bone and Joint Surgery Clinic, we are really at the cutting edge of technology, and I was very happy to join a group about 5 years ago, Bone and Joint, where we use a lot of ultrasound. So ultrasound is a great new technology that helps me not only diagnose carpal tunnel, but also treat it. And so basically what ultrasound is a simple device that emits some sound waves. It turns those sound waves into a picture that I see. So I can diagnose your carpal tunnel syndrome with a few questions and a physical exam. You don't need painful and expensive nerve studies. Really, all I do is place this ultrasound probe on your wrist. I measure your nerve, and I see how swollen that nerve is, and I'm able to see and diagnose that condition with the ultrasound. Now I can also treat it with the ultrasound. So the ultrasound waves themselves don't treat it, but I view the release procedure with the ultrasound. So what this does is instead of a classic incision on the wrist where we used to have to make a big, long, open incision in the palm to release the nerve, I'm able to make a teeny little poke incision right here on the wrist, and view all the work that I'm doing with the ultrasound. So this is a big benefit for patients because they don't need anesthesia. They do need a little bit of numbing medicine in this area, but that is it. There's no IV, there's no tube down the throat, there's no painful squeeze or tourniquet on the arm, and we treat a lot of these both sides at the same time. So if a patient has bilateral carpal tunnel, both hands, we can treat them on the same day.
Wow, technology, man.
It's amazing.
So what's the healing process like? Is it if I have it in both hands, am I gonna be able to still function on a day-to-day basis, or are we gonna need some time to recover?
Absolutely, Carl. That's a great question. So big thing I say to every patient is millimeters do matter when it comes to the healing here. The traditional open incision fixes the problem. The bad thing is there's a lot of what I call innocent bystander tissue in that, right? So in terms of releasing your carpal tunnel, this is the least invasive way to go because we're not going through that skin here in the carpal tunnel or over the palm. And so patients are able to get back to things right away. So these patients, you do have a little wrap on your hand for about 2 days, but in terms of driving your car, dressing yourself, making food in the kitchen, even if you have both sides done, I don't give you any restrictions. You're back to those things right away.
Piece of cake. That's so awesome. Well, I know a lot of viewers out there, their ears are probably perked up. They're listening. They're like, I'm dealing with this. Please help me, doctor.
Absolutely.
So if they need an appointment, if they want a consultation, if they want some more information, they just need a little bit of encouragement to come and make an appointment or get some help, where can we do that?
Sure. They can always visit my website, www.raleighupperex.com. I also have a little bit of a YouTube presence, so you can just look for my name on YouTube. I have some videos about ultrasound and carpal tunnel release with ultrasound-guidance.
Yeah.
And of course, they can call the Bone and Joint Surgery Clinic at 919-872-5296. Our front desk folks are phenomenal, and they'll get a visit in to see me anytime that it's convenient.
Perfect. Well, that is so nice. I know you're easing some people's minds when it comes to going to the doctor and making those appointments. We appreciate you being here.
Thank you, Carly.